Seniors, what your blood pressure say about your health. Don't ignore this. For many of us, our doctor's visit involves a familiar ritual, the blood pressure cuff. It's a routine check, something that happens every single time we see our physician. Yet, according to Dr. Claire Whitmore, a cardiologist with 2 decades of experience, this crucial measurement often receives only a fleeting glance, a mere 3 seconds, before the focus shifts elsewhere. In those brief moments, a wealth of information, warnings that could profoundly impact our independence, our cognitive abilities, and even our very lives, are being missed. Dr. Whitmore's extensive career has led her to witness a distressing trend. Sharp, active seniors losing vital aspects of their lives, not due to acute illness, but because they weren't taught to interpret the silent cries of their own blood pressure readings. The common scenario is familiar. The cuff is applied, the machine beeps, displaying numbers like 135/82. The doctor, often deeming it acceptable, moves on. But within those 2 simple numbers lie a complex narrative, a series of 6 critical warnings about what's unfolding inside our bodies. These are not esoteric medical signs. They are direct indicators of our risk for losing independence, succumbing to memory loss that erases loved ones from our minds, or even facing a life-threatening event in our sleep. The tragedy is that this vital diagnostic tool is readily available, often measured for free at home, yet the knowledge to truly understand its language is rarely imparted. The current medical approach, Dr. Whitmore points out, often overlooks key indicators. Doctors may not be scrutinizing the crucial gap between the systolic and diastolic numbers, a gap that can betray dying arteries. The simple act of checking blood pressure in both arms, a practice that could reveal an imminent stroke risk if a significant difference exists, is frequently neglected. Similarly, the subtle patterns within readings that signal failing kidneys are often missed. All this critical data is present, yet it goes unheeded. By the end of this discussion, the 6 vital warnings embedded in your blood pressure will be clear, empowering you to identify them in your own readings. Warning number 1, surprisingly, has no bearing on whether your pressure is perceived as high or low. Warning number 3 carries a particularly infuriating revelation about the preventable nature of most kidney failure. And warning number 6, a simple check you can perform immediately after this video concludes, holds the potential to save your life today, as it's intrinsically linked to preventing a 7th, potentially fatal, warning. This isn't about a fear of high blood pressure or the necessity of more medication. It's about recognizing your body's urgent communication and learning to respond. Ignoring these signals risks the loss of the very life you cherish. Staying engaged with this information could be the key to maintaining your autonomy, your mental acuity, and your precious time with family for years to come. Consider the story of Robert, a 72-year-old retired mechanical engineer, a man whose sharp intellect and passion for problem-solving defined his post-retirement life. For 2 years, Robert's blood pressure had hovered around 160/65. His doctor, understandably, focused on the elevated top number, consistently stating, "We need to get that 160 down." This led to a regimen of increasing medication, with doses adjusted and combinations experimented with. Yet, the systolic number remained stubbornly at 160. What was overlooked, however, was the significant gap between his top and bottom numbers, a difference of 95 points, 160 minus 65. This substantial gap was a blaring siren, a warning that tragically went unheard, a warning that could have potentially saved Robert from his devastating fate. In youth, our arteries are supple and elastic like garden hoses, expanding and recoiling with each heartbeat, ensuring smooth, controlled blood flow. This elasticity typically results in a pulse pressure, the difference between the systolic and diastolic numbers, of around 40 to 50 points. Robert's arteries, however, had lost this vital flexibility. They had become rigid, akin to unyielding metal pipes. When his heart pumped, the surge of blood met these stiff walls, causing a dramatic spike in pressure, hence the high systolic reading of 160. But between beats, the lack of elastic recoil meant the pressure dropped precipitously, explaining his low diastolic of 65. The gaping 95-point pulse pressure was a clear indication of arterial decay and a dire warning of imminent danger. The relentless pounding of each pressure wave was directly impacting his brain. Despite feeling perfectly fine, walking, working, and living his life, a sudden catastrophic event occurred. One Tuesday afternoon, while engrossed in a woodworking project in his garage, Robert lost his ability to speak. His words became garbled, his right side weakened. His wife discovered him on the floor, disoriented and struggling to communicate. A massive stroke had struck. By the time emergency services arrived and transported him to the hospital, irreversible brain damage had occurred. Robert survived, but the stroke left him with permanent damage to his right arm, the limb he relied on for woodworking, golf, and writing. His speech is now slurred, and he struggles to articulate his thoughts, his once sharp engineer's mind trapped within a body that no longer cooperates. His wife's heartbreaking words that he now sits in his garage gazing at his tools, unable to use them, paint a poignant picture of a life irrevocably altered. This stroke, she revealed, was entirely preventable. The warning was present in his blood pressure readings for 2 years. A pulse pressure of 95 points signaled an overwhelmingly high risk of stroke. Had this number been calculated and understood, Robert's treatment would have been entirely different. Instead of merely focusing on lowering the systolic number with medication, interventions aimed at restoring arterial flexibility, such as magnesium supplementation and compounds that enhance nitric oxide production, coupled with lifestyle changes to reduce arterial stiffness, could have been implemented. Robert might still be in his workshop, on the golf course, living the life he loved, but the knowledge to recognize and act on this critical warning was absent. Now, let us delve into what you should be looking for. Your pulse pressure is calculated by subtracting your bottom number, diastolic, from your top number, systolic. A pulse pressure exceeding 60 points should raise concern. Beyond 70 points, it becomes dangerous, and surpassing 80 points signals serious trouble. A reading over 90, as in Robert's case, indicates an extreme risk and demands immediate action. This isn't solely about stroke. A wide pulse pressure signifies that your heart is working against rigid, unyielding arteries, leading to its premature wear and tear. It also means that every organ in your body, including your kidneys, eyes, and brain, is subjected to relentless, excessive pressure, suffering cumulative damage. Research published in the esteemed journal Hypertension tracked over 5,000 individuals aged 65 and older for 8 years. Those with a pulse pressure exceeding 70 points exhibited a doubled risk of stroke. This risk tripled for individuals with a pulse pressure over 80 points. The profound tragedy lies in the simplicity of this calculation. A 3-second subtraction that could reveal such critical information, yet it remains outside standard medical protocols and guidelines, thus frequently overlooked. This oversight leads to preventable tragedies like Robert's stroke. Moving on, we encounter warning number 2, a revelation that might challenge conventional understanding of blood pressure management. Warning number 2. When your bottom number is too low, your heart is silently deteriorating, and you remain unaware of the danger. While the focus is overwhelmingly on high blood pressure and its association with heart attacks, a dangerously low diastolic number can be equally, if not more, perilous, primarily because it is so rarely monitored. Consider Helen, a vibrant 76-year-old retired schoolteacher who cherished reading to her grandchildren and tending to her garden. She had been on blood pressure medication for 15 years, with her doctor gradually increasing the dosage as her systolic number crept upward. By the time she sought my advice, she was taking 3 different blood pressure medications. Her most recent reading was 145/55. While her doctor expressed satisfaction with the lower diastolic number, I recognized it as a grave warning sign. Most people fail to grasp the significance of the diastolic pressure. This number represents the pressure within your arteries when your heart is at rest between beats. Crucially, during this resting phase, blood flows into your coronary arteries, the vital, delicate vessels that nourish your heart muscle with oxygen. A constant supply of oxygen is essential for the heart's function. If this supply is compromised, the heart muscle begins to suffer damage. The critical point is that your coronary arteries receive their blood supply exclusively during diastole. Consequently, A low diastolic pressure directly translates to reduced blood flow to these essential vessels. It's a matter of basic physics. Low pressure equates to low flow. When your heart muscle is deprived of adequate oxygen, it endures silent progressive damage, a condition known as silent ischemia. Your heart is, in essence, suffocating without any outward indication. Helen had been living with a diastolic pressure of 55 for 3 years. 3 years of her heart being starved of oxygen, accumulating damage without her knowledge. She experienced no chest pain or shortness of breath. She felt perfectly well until one morning while preparing breakfast, she was overcome by crushing chest pressure and an inability to breathe. In a terrified state, she managed to call 911. Upon arrival at the hospital, she was suffering a massive heart attack, with a significant portion of her heart muscle already compromised. An emergency cardiac catheterization revealed that her coronary arteries, while not severely blocked, had a 50% narrowing in one vessel. In a younger individual or someone with normal diastolic pressure, this degree of narrowing would likely not trigger a heart attack. However, Helen's chronically low diastolic pressure had created a perilous situation where even moderate blockages became catastrophic. For 3 years, her heart had been functioning precariously, receiving just enough blood flow to survive, until it finally crossed the threshold into complete oxygen starvation. Helen survived, but her heart is permanently damaged. She tires easily, can no longer garden with her former vigor, and must constantly monitor her activity levels. Simple pleasures that once brought her joy now leave her utterly exhausted. All of this could have been averted had her dangerously low diastolic of 55 been recognized as a threat 3 years prior. Scientific evidence strongly supports this concern. A comprehensive analysis published in the Journal of the American College of Cardiology, involving over 11,000 patients with coronary artery disease, found that those with a diastolic pressure below 60 had a 49% increased risk of heart attack. This risk more than doubled for individuals with a diastolic pressure below 50. Adequate pressure during the heart's resting phase is indispensable for perfusing the coronary arteries. Without it, the heart slowly starves. The cruel irony of this situation is often exacerbated by medication. When doctors prescribe blood pressure medications, particularly multiple agents, they typically lower both systolic and diastolic numbers. A physician might lower a systolic of 145 with an additional medication, bringing it to 130. But in doing so, they might inadvertently drop the diastolic from 65 to 50. This constitutes an overcorrection, creating a new, dangerous problem while attempting to address the old one. Because the prevailing focus remains on the systolic number, the life-threatening implications of a plummeting diastolic pressure are frequently overlooked. If you are taking multiple blood pressure medications and your diastolic pressure consistently falls below 60, it is imperative to discuss potential dosage adjustments with your doctor. Protecting your heart from high systolic pressure while simultaneously starving it with low diastolic pressure is not effective medicine. It is a dangerous trade-off. Now, let us examine warning number 3, an issue that is likely to evoke significant frustration and anger. Warning number 3. When your blood pressure suddenly becomes uncontrollable, it is a potent signal that your kidneys are in distress and time is rapidly diminishing. The story of Thomas, a 69-year-old man, illustrates a scenario unfolding for thousands of seniors, yet the critical connection remains undiscovered. For 15 years, Thomas's blood pressure had been consistently well managed on a single medication, reading a textbook 125/78. He diligently took his pill each morning, never missed a dose, and maintained a healthy lifestyle. Then, a change occurred. Over approximately 3 months, his blood pressure began to climb inexorably, from 140/85 to 155/92, and then to 165/98. His doctor, concerned, increased his medication dosage, but to no avail. A second medication was added, providing a brief respite of a week before the pressure surged again. A third medication followed, yet the numbers continued their upward trajectory. 175/102, then 180/106. Thomas's physician diagnosed it as resistant hypertension, continuing to prescribe more medications. A fourth and then a fifth medication were added, none of which proved effective. His blood pressure continued to climb, defying all pharmaceutical interventions. The crucial question that was never asked was, why? Thomas's blood pressure had been stable for 15 years with the same medication, dosage, and lifestyle. Suddenly, it had become erratic. Medications that should have been effective were failing. This wasn't merely resistant hypertension. It was a symptom, a desperate cry from his body indicating a serious underlying problem. In Thomas's case, his kidneys were signaling their distress through his blood pressure readings. Your kidneys possess their own dedicated blood supply through the renal arteries, one leading to each kidney. These arteries can narrow due to cholesterol plaque buildup, much like arteries elsewhere in the body. When they become constricted, the kidneys receive insufficient blood flow. In response, these remarkably intelligent organs perceive this reduced blood supply as a systemic shock, believing the body's overall blood pressure has dangerously plummeted. To counteract this perceived crisis, they activate an emergency system, releasing hormones like renin and angiotensin. These hormones constrict blood vessels throughout the body and signal the kidneys to retain salt and water, all with the objective of elevating blood pressure and restoring adequate blood flow to the kidneys. However, when the root cause is narrowed renal arteries, increasing overall blood pressure offers no solution. The physical obstruction remains. Consequently, the kidneys continue to release these potent hormones, driving blood pressure ever higher in a futile attempt to force blood through the compromised arteries. This creates a vicious cycle. Elevated blood pressure further damages the kidneys, which in turn release more hormones, leading to even higher blood pressure. All the while, the patient is burdened with 5 medications that fail to address the fundamental issue. Thomas's kidneys were screaming for help through his blood pressure readings, but the medical focus remained solely on reducing the numbers, neglecting the critical inquiry into the sudden and dramatic rise. It took 6 agonizing months before an ultrasound of Thomas's renal arteries was finally ordered. By then, his right kidney had atrophied, becoming small, scarred, and largely non-functional. His left kidney, compensating heroically, was under immense strain. Had this condition been detected earlier, had the sudden, uncontrollable rise in blood pressure been recognized as a symptom of a serious underlying issue, the renal arteries could have been opened through a simple procedure, preserving kidney function. Now, Thomas faces a future of progressive kidney decline, likely requiring dialysis, a time-consuming and life-altering treatment 3 times a week. His independence and freedom will be compromised, all because the crucial message from his blood pressure went unheeded. Studies indicate that approximately 10 to 20% of cases of resistant hypertension stem from renal artery stenosis, yet it remains severely underdiagnosed because physicians often fail to investigate it, instead opting to simply add more medications. If your blood pressure was once well controlled and has suddenly become unmanageable, demand a thorough investigation, including an ultrasound of your renal arteries. This non-invasive and painless procedure can reveal a completely treatable problem before irreversible damage occurs. It's important to note that renal arteries are not the sole culprits. Tumors in the adrenal glands, which secrete hormones that drastically elevate blood pressure, and severe sleep apnea, characterized by dozens of breathing pauses per hour, leading to massive blood pressure surges, can also reset the cardiovascular system to a higher baseline over time. The fundamental principle here is that sudden, uncontrollable blood pressure is not merely resistant hypertension. It is a symptom of an underlying condition that requires identification and correction. Before delving into warning number 4, which illuminates how your nighttime blood pressure can mask diabetes that threatens your vision and limbs, I must ask for your engagement. If you find this information valuable, if it's revealing aspects of blood pressure management your doctor has never explained, please share this video. Consider your family, friends, and anyone struggling with blood pressure issues. This knowledge could profoundly change their lives. Subscribe to this channel. My mission is to equip you with the information needed to maintain your independence, stay sharp, and remain connected with your loved ones for as long as possible. Now, let us explore warning number 4, a connection between blood pressure and a condition you might not expect. Warning number 4. Your blood pressure patterns during the night can reveal hidden diabetes that is silently wreaking havoc on your body. A crucial fact often overlooked is that your blood pressure should naturally decrease by 10 to 20% while you sleep. This phenomenon, known as nocturnal dipping, is your body's way of providing a much-needed rest period for your heart and blood vessels after a day of continuous work. However, in some individuals, this dip fails to occur. Their nighttime blood pressure remains as high as during the day, or in some cases, even rises. This pattern is a powerful predictor of stroke, kidney disease, and diabetes. Let me introduce Margaret, a 71-year-old retired accountant, meticulous in her health tracking. She checked her blood pressure twice daily, morning and evening, meticulously recording her readings. Her numbers were consistently within the normal range, morning readings around 128/80 and evening readings around 132/82. Her doctor was satisfied, but Margaret felt chronically unwell, experiencing profound fatigue, waking as if she hadn't slept at all, and frequently needing to urinate 4 or 5 times each night, unable to complete the night without bathroom trips. When she mentioned these symptoms to her doctor, he attributed them to aging or an overactive bladder, offering medication. However, Margaret's symptoms, the exhaustion, the incessant nighttime urination, and the feeling of being worse in the morning, troubled me. I ordered a 24-hour ambulatory blood pressure monitor, a device that records blood pressure every 20 minutes around the clock, including during sleep, offering a comprehensive view of your cardiovascular status when you are unable to self-monitor. The results were startling. Margaret's daytime blood pressure appeared normal, mirroring her home readings. However, at night, her pressure soared to 165/98, alarmingly higher than during the day. This condition, known as reverse dipping, is exceptionally dangerous. I initiated further testing. Her fasting blood sugar was within the normal range, and her hemoglobin A1C, a measure of her 3-month average blood sugar, was only slightly elevated, not indicative of full-blown diabetes. Standard screenings suggested she was at most pre-diabetic. However, I decided to investigate further. I fitted Margaret with a continuous glucose monitor for 2 weeks, a device that tracks blood sugar levels every 5 minutes, day and night. This revealed the truth. Her daytime blood sugar was normal, but at night, while she slept, it spiked to over 200. She was experiencing nocturnal hyperglycemia, a form of hidden diabetes that manifested only during the night. Here's the underlying mechanism. Elevated blood sugar compels the kidneys to work overtime, filtering excess glucose and excreting it in the urine, explaining Margaret's frequent nighttime urination as her kidneys struggled to clear the sugar. Simultaneously, high blood sugar activates stress hormones and the sympathetic nervous system, leading to sustained elevated blood pressure. Consequently, instead of dipping, Margaret's blood pressure remained high because her body was under constant metabolic stress. By addressing her nighttime blood sugar, we observed a remarkable improvement. Within 2 weeks, her nighttime blood pressure normalized, she began experiencing nocturnal dipping, her frequent urination ceased, and her energy levels returned. She felt like a new person. The critical takeaway here is that if we had relied solely on daytime blood pressure readings and standard diabetes screenings, this hidden condition would have remained undetected. Her daytime blood sugar was normal, and the problem was concealed during the night. This underscores the importance of recognizing subtle symptoms. Frequent nighttime urination, unexplained fatigue, and poor sleep despite adequate hours in bed are all potential clues that something is amiss during the night. A 24-hour blood pressure monitor can often reveal these hidden issues. Research demonstrates that individuals who do not experience nocturnal dipping have a 3-fold increase in stroke risk. Their brains are subjected to constant, unrelenting pressure, with no opportunity for recovery. Eventually, something gives. A blood vessel ruptures, a clot forms, and a stroke occurs. The warning was present in the blood pressure pattern, a pattern that was simply not being monitored. Now, let us turn our attention to warning number 5, a crucial indicator directly linked to the preservation of your cognitive faculties. Warning number 5. When your blood pressure fluctuates wildly from day to day, it signals silent strokes that are progressively damaging your brain. While it's generally understood that blood pressure naturally varies with activity, rest, stress, and relaxation, some individuals experience extreme and erratic swings. For instance, a reading of 110/65 one morning might be followed by 180/100 just 3 hours later, with a subsequent reading of 120/70 the next day, only to spike again to 175/95 the day after. This is not normal variation. It is indicative of dangerous blood pressure variability, a phenomenon that can have catastrophic consequences for your brain. Let me introduce Richard, a 74-year-old retired architect who deeply valued data and precision. He diligently checked his blood pressure 3 times daily, meticulously recording every reading in a spreadsheet. He sought my help due to the chaotic nature of his numbers. One day his reading was 108/62, the next it was 192/108. His physician repeatedly adjusted his medications, but no intervention could stabilize his readings, which continued to swing wildly. We discovered that Richard had autonomic dysfunction, a condition where his autonomic nervous system, responsible for automatically regulating blood pressure, was not functioning correctly. Every time he stood up, his blood pressure would plummet, leaving him dizzy and lightheaded. His body would then overcompensate, flooding him with adrenaline, causing his pressure to skyrocket. The same pattern occurred after every meal, as blood rushed to aid digestion, causing a pressure drop and a subsequent overreaction leading to a pressure spike. His system had lost its ability to regulate smoothly. This is particularly devastating for the brain. Studies have shown that blood pressure variability is one of the strongest predictors of dementia, even more so than consistently high average blood pressure. A study published in Circulation followed 5,500 individuals for 25 years. Those exhibiting high blood pressure variability had a 46% increased risk of developing dementia. The constant oscillations damaged the delicate small blood vessels in the brain, leading to micro-ruptures, leakage, and the formation of silent strokes, tiny areas of dead brain tissue that accumulate over time. These events occur without noticeable symptoms or warnings, yet they steadily destroy brain tissue. Within a year of diagnosis, Richard began experiencing memory problems, misplacing items, and losing his train of thought. By 18 months, he was showing significant cognitive decline, repeating stories within the same conversation, forgetting appointments despite having them documented, and getting lost on familiar routes. An MRI scan revealed extensive white matter damage in his brain, indicative of hundreds of small, old strokes scattered throughout. These were the cumulative result of years of his blood pressure hammering and dropping, progressively killing brain cells. Could this have been prevented? Perhaps. If the blood pressure variability had been recognized earlier, and the focus shifted to stabilizing his pressure rather than just lowering it, the outcome might have been different. However, by the time the cause was understood, significant and irreversible damage had already occurred. To determine if you are experiencing dangerous blood pressure variability, check your blood pressure at the same times daily for 2 weeks. Analyze the range of your readings. If your systolic number varies by more than 20 points from day to day, it warrants concern. A variation exceeding 30 points is considered dangerous and requires medical evaluation. Causes can include autonomic dysfunction stemming from diabetes or nerve damage, improperly dosed medications, dehydration, sleep apnea, or untreated anxiety. These issues need to be identified and addressed, as your brain is paying the price daily. We now arrive at warning number 6, the most critical warning of all. It requires your immediate attention and action today. Warning number 6. A difference in blood pressure readings between your right and left arms signifies advanced disease that could be life-threatening, even while you sleep. The vast majority of people only check their blood pressure in one arm, typically the left if they are right-handed. This is a significant oversight, as a difference of more than 10 points between the two arms is not normal variation, but a medical emergency. Allow me to share the story of Dorothy, and I urge you to consider that this could be your situation right now. Dorothy, a 73-year-old woman, had been consistently checking her blood pressure on her left arm every morning for 10 years. Left arm, press start, record the number. Her readings were consistently good, around 125/78, and she felt perfectly healthy, experiencing no symptoms whatsoever. During her annual physical, she saw a new doctor, as her previous physician had retired. This new doctor performed a thorough examination, including checking the blood pressure in both arms, something her previous doctor had never done. Her left arm reading was 125/78, while her right arm reading was a startling 180/105. This represents a difference of 55 points, a finding that is far from normal and indicative of a grave medical emergency. That physician immediately referred Dorothy for vascular imaging, including an ultrasound of her arteries and a CT angiogram. The results were deeply concerning. Dorothy had severe atherosclerosis, a condition characterized by significant plaque buildup. The artery supplying her right arm, the subclavian artery, was 90% blocked. This extreme narrowing explained the exceptionally high pressure reading in her right arm, as her body generated massive pressure in an attempt to force blood through the constricted opening. However, this was not the most alarming finding. The same disease process that was blocking her arm artery was also severely affecting the artery supplying her brain. Her left carotid artery, the primary vessel supplying the left side of her brain, was 80% blocked. This means Dorothy was walking around with a ticking time bomb in her neck. That blockage could have ruptured, or a clot could have dislodged and traveled to her brain, leading to a massive stroke. She could have lost her ability to speak, to move, or to recognize her family, or she could have died suddenly, and no one would have foreseen it because her left arm pressure appeared normal. Medically, a significant difference in blood pressure between your arms signifies atherosclerosis severe enough to obstruct blood flow considerably. If it is affecting one arm, it is highly probable that other arteries are also compromised, including those supplying your brain, kidneys, heart, and legs. This indicates systemic vascular disease, a life-threatening condition. A study published in The Lancet involving over 28,000 individuals found that those with an arm pressure difference of 15 points or more had a 60% higher risk of cardiovascular death, increased stroke risk, and a higher likelihood of developing peripheral vascular disease requiring amputation. Dorothy's case is particularly critical because she had no symptoms, absolutely none. She felt completely healthy, and the arterial blockages were not causing pain, weakness, or any warning signs she could perceive. The sole clue was the disparity in her blood pressure readings. Dorothy underwent surgery, a carotid endarterectomy, to clear the blockage and restore blood flow to her brain. This was a major procedure with inherent risks, but the risk of not undergoing it was far greater. She survived, recovered, and thankfully did not suffer a stroke, all because her blood pressure was checked in both arms. I implore you to take action today. After finishing this video, check your blood pressure on both arms. If there is a difference of more than 10 points, contact your doctor first thing tomorrow morning. If the difference exceeds 15 points, call your doctor today. If the difference is more than 20 points, go to the nearest emergency room immediately. Do not delay. This is not a condition to monitor. It demands immediate intervention. Let us consolidate what these 6 warnings signify collectively, recognizing that your blood pressure provides a holistic picture of your health, not just a single reading. Warning 1. A pulse pressure exceeding 70 points indicates stiff arteries and a heightened risk of stroke. Warning 2. A diastolic pressure below 60 suggests your heart is not receiving adequate blood supply. Warning 3. A sudden, uncontrollable rise in blood pressure signals a serious issue with your kidneys or hormonal system. Warning 4. The absence of nocturnal dipping points to hidden diabetes that is actively damaging your body. Warning 5. Excessive blood pressure variability signifies that silent strokes are progressively destroying your brain. Warning 6. A difference in arm readings indicates advanced disease requiring urgent medical treatment. These warnings are present in your current blood pressure readings, but you must actively seek them out. Calculate the pulse pressure, check both arms, track your readings for patterns, and remain vigilant for any changes. Your blood pressure is communicating vital information about your kidneys, heart, brain, and arteries. The critical question is, are you listening? Here is your action plan. First, invest in a quality home blood pressure monitor, preferably an upper arm cuff, not a wrist monitor. Check your pressure at the same times daily, both morning and evening. Second, check both arms weekly, meticulously recording both readings and noting any differences. Third, calculate your pulse pressure with every reading. If it consistently exceeds 70 points, discuss it with your doctor. Fourth, monitor your diastolic pressure. If it is consistently below 60, your medication regimen likely needs adjustment. Fifth, track patterns and keep a detailed log. Be alert for excessive variability. Sixth, if you experience symptoms such as nighttime urination, fatigue, or memory problems, request a 24-hour blood pressure monitoring. Seventh, bring your logs to your appointments and actively engage your doctor. Ask pointed questions. Why is my pulse pressure so high? Why does my diastolic pressure keep dropping? Why haven't we checked both arms? These questions could genuinely save your life. Allow me to share the story of James, a 77-year-old whose blood pressure was in a state of profound chaos, a condition that had eluded previous medical interventions. Upon meticulously analyzing his logs, I identified a pulse pressure exceeding 80 points, a diastolic pressure below 60, and massive variability. Critically, no one had ever checked both of his arms. When I did, the left arm reading was 138/56, while the right arm reading was a staggering 182/94, a difference of 44 points. James presented with 4 simultaneous critical red flags. Comprehensive imaging revealed severe narrowing of his renal arteries, a blockage in his carotid artery, and a stiffening of his aorta, along with evidence of autonomic dysfunction. He was quite literally a catastrophe waiting to happen. However, we intervened. He underwent procedures to open his arteries, his medications were carefully adjusted, and he received treatment for his autonomic issues. Today, 3 years later, James is thriving. He has not experienced a stroke or a heart attack, and his kidney function remains stable. This positive outcome is a direct result of finally viewing his blood pressure not merely as a number to be controlled, but as a crucial diagnostic tool. This is precisely what I wish for you: the understanding that your blood pressure is a powerful messenger, and you must actively listen to its communication. Track it diligently, analyze patterns, and pose insightful questions. Your blood pressure holds the potential to preserve your independence, maintain your mental acuity, and keep you connected with your loved ones. Or conversely, it could be screaming warnings that are currently being ignored. If this video has illuminated new insights for you, please share it, subscribe to this channel, and initiate conversations about blood pressure management with your physician. Do not allow these vital warnings to go unheeded. Your blood pressure is speaking. Ensure you are actively listening. Thank you for your time. Take good care of yourself. I look forward to seeing you in the next video as we continue to explore the health truths that can empower you to live the life you love.